Welcome to Adolescent Mental Health Emergencies, Managing ICE, Methamphetamine, Intoxication in Youth. This course is designed to give you the practical knowledge and skills needed to safely recognize, de-escalate, and manage methamphetamine intoxication in adolescence. Across 3 CPD hours, we will explore evidence-based approaches, sedation pathways, and aftercare planning, equipping you to respond confidently in high-pressure clinical situations. Who should take this course? This course is tailored for frontline health professionals who frequently encounter adolescents in acute or mental health crises. It is highly relevant for emergency department nurses, pediatric nurses, registrars, junior medical officers, CAMS clinicians, and ambulance staff. It also supports rural and remote health workers, school nurses, counsellors, GPs, and youth alcohol and other drug workers. If you work with adolescents who may present with behavioural disturbance or stimulant use, this course is designed for you. Why this course matters. Methamphetamine intoxication, often referred to as ICE, is one of the most complex and dangerous adolescent presentations in EDs today. Young people may arrive agitated, aggressive, hallucinating, or overheated. This places both staff and the patient at significant risk. Delays in recognition and poor management can result in arrhythmias, rhabdomyolysis, or even death. By the end of this course, you will understand how to manage these emergencies safely, apply de-escalation techniques, and follow state-aligned sedation and aftercare pathways. Module 1. Recognizing ICE intoxication in adolescence. In Module 1, we begin by recognizing the signs of methamphetamine intoxication. We will cover how ICE affects the adolescent brain and body, leading to symptoms such as extreme agitation, paranoia, hallucinations, tachycardia, and hyperthermia. You will learn to spot high-risk complications, including arrhythmia and rhabdomyolysis, and identify red flags that demand urgent escalation in ED or pre-hospital care. This foundational knowledge sets the stage for safe and effective management. Module 2. De-escalation and ED safety. In Module 2, we focus on safety. Methamphetamine-intoxicated adolescents can become unpredictable and dangerous. We will use the ASBD, or Acute Severe Behavioral Disturbance, framework. This provides a structured way to keep patients, staff, and families safe. You will learn about team roles, the importance of safety huddles, verbal de-escalation techniques, and environmental strategies such as safe room setup. The goal is always to reduce the need for restraints and to delay or avoid sedation where possible, while still maintaining safety. Module 3. Sedation pathways. When de-escalation is not enough, sedation may be required. In this module, you will learn about state-aligned sedation pathways. First-line treatment typically involves benzodiazepines. If ineffective, second-line options include droperidol and atypical antipsychotics. You'll also learn how sedation reduces agitation, prevents hypothermia, and protects against rhabdomyolysis. Finally, we'll cover post-sedation monitoring, including airway support, vital signs, ECG monitoring, and clear documentation. Module 4. Hypothermia and rhabdomyolysis. Meth-induced hypothermia is life-threatening. In this module, we will explore how to recognize and manage it quickly. You'll learn stepwise cooling strategies, from controlling the environment and applying ice packs to using active cooling devices. We will also discuss IV fluid resuscitation, electrolyte monitoring, and prevention of rhabdomyolysis. This module equips you with the tools to stabilize one of the deadliest complications of stimulant intoxication. Module 5, Methamphetamine Psychosis versus Primary Psychosis. Not every psychotic presentation in a young person is schizophrenia. In this module, we differentiate between methamphetamine psychosis and primary psychosis, such as first episode schizophrenia. You will learn how symptom onset, course, and prognosis differ, and what this means for emergency care. Correctly identifying methamphetamine-associated psychosis ensures appropriate treatment and referral, avoiding misdiagnosis. Module 6, Aftercare, CAMS pathways and cultural safety management doesn't stop at sedation. Aftercare is essential. In this module, we'll cover discharge planning, relapse prevention, and when to refer to CAMS or AOD services. We'll also explore how to educate parents and carers on what to expect after ED discharge. Special focus will be given to First Nations adolescents, using yarning, family involvement, and cultural safety to ensure equity and trust in care. Module 7, Clinical Scenarios and Decision Making. This module brings everything together with real-world scenarios. You'll step through a case of a 16-year-old presenting with aggression and hallucinations, from triage to de-escalation and sedation. We'll discuss managing co-ingestants like alcohol or benzodiazepines and highlight safe decision-making frameworks. The module closes with guidance on debriefing, staff support, and reflective practice after a high-risk incident. Learning outcomes. By the end of this course, you will be able to recognize the key signs of methamphetamine intoxication in adolescents, apply ASBD-aligned de-escalation and safety strategies, follow sedation algorithms confidently, manage hypothermia and rhabdomyolysis, distinguish methamphetamine psychosis from primary psychosis, plan safe discharge and referral with cultural safety principles. CPD course assessment. To consolidate your learning, you'll complete a short assessment covering recognition of stimulant intoxication, safe de-escalation strategies, sedation pathways and monitoring, hypothermia and rhabdomyolysis management, psychosis differential and referral. Passing this assessment confirms your competence in adolescent methamphetamine emergency care. Certificate and CPD credit. On successful completion of the course and assessment, you will receive a digital certificate of completion. This certificate confirms 3 CPD hours in adolescent mental health emergencies, methamphetamine intoxication management. Your learning can be added to your professional portfolio and submitted for CPD accreditation.